Hello everybody, hi, I'm Jewel and welcome. Welcome to my channel. I hope all of you guys are doing well. I hope that you have everything you need, your families are safe, and of course, the most important, your health is stable. Today's topic is improving transportation to dialysis during a pandemic and beyond. It was written by Tori Cranzy, CEO of the National Kidney Foundation of Louisiana. Okay, guys, let's get started. The COVID-19 pandemic has further exacerbated transportation issues frequently faced by hemodialysis patients, many of whom are missing sessions because they don't have a ride. Louisiana and New Orleans in particular has the highest rates of diabetes, hypertension, and kidney disease in the country, which put kidney patients at higher risk for developing more serious coronavirus illnesses. Basically, New Orleans is a petri dish for COVID-19. Transportation problems were already one of the most common barriers faced by low-income communities to accessing timely and necessary medical care. For hemodialysis patients, staying healthy depends on reliable transportation because they are required to visit a dialysis center 3 times a week. There have been many studies indicating that easy access to transportation is associated with greater quality of life and supports improved patients' outcomes. With grant funding, the National Kidney Foundation of Louisiana, NKFL, is conducting a beta transportation study in New Orleans that will ensure patients have safe, reliable, and on-time emergency transportation to and from dialysis. Our community stakeholders are focused on dependability and safety of rides, flexibility and ride scheduling, rider frustration with wait times, and excessive cost. NKFL staff has researched different transportation models and their outcomes. Over the next few weeks, we will identify a staff person at each dialysis unit in NOLA who will be responsible for executing the program in their unit and train them on how to use the system. Once launched, we will review the overall success of the program and seek further funding to slowly expand the initiative throughout Louisiana. The success of the program has broad implications and increases opportunities for sustainability by looking beyond current transportation options. NKF is also working on the national stage to help patients secure safe and affordable transportation to dialysis. Last month, NKF sent a series of letters to Medicare Administration Contractors, MACS, asking that they pay for ground ambulance transportation for end-stage renal disease patients who are COVID-19 positive or under investigation for COVID-19 and who may be unable to secure other transportation. As a result of that outreach, we have already heard from several MACs that are looking at their policies for non-emergency ground ambulance support. NKF is also working to ensure that dialysis patients who receive transportation through their state Medicaid program can either access their usual non-emergency medical transport, NEMT, or have an alternative option. We ask that you and the rest of the kidney community keep sharing your stories of achieving and challenges with us, and please reach out directly if you need any assistance. We will stand ready to help you in this time of need. Okay, everyone, this was improving transportation to dialysis during a pandemic and beyond. And as you have heard, in Louisiana and New Orleans, they're having such a difficult problem finding transportation for hemodialysis patients, especially those that have contacted COVID-19 and they're finding that a lot of transportation options have dried up because a lot of people do not want to carry COVID-19 patients in their transportation, which is not right because they need dialysis also. So what Louisiana is trying to establish, which goes beyond the pandemic, is to find transportation throughout the state, because in low-income communities, they're finding that a lot of dialysis patients are not coming to dialysis because they do not have transportation, and it's become a really, really big issue in their state. So they are trying new programs to help those that are in low income that don't have transportation to make sure that they get to their dialysis, because of course without dialysis your body starts to become very, very sick, and you need dialysis, of course, in order to live with those that have ESRD, end-stage renal disease. So guys, if you found this information useful in any way, please like, share, and subscribe. And as always, I'm sending all of you so much love, so much affection, affection, because as always, I have been there just with you guys. I have been with my early stage of kidney disease. I had a lot of issues trying to find transportation also, but this was over 25 years ago, and a lot of things have improved since then. So what the National Kidney Foundation is trying to do is improve these issues with kidney patients that don't have transportation in low-income areas, which would be a great thing for those people with dialysis. So guys, of course, the only thing you have to do is always stay compliant with your doctor's orders, and of course with the CDC, which are giving us lots of information to keep ourselves safe through this pandemic, by wearing our mask, by having, gloves, by not touching our face, and of course washing our hands. So guys, this article, of course, states that, which is what the National Kidney Foundation is doing right now, trying to find and build more resources in low-income communities, because this is a problem with a lot of medical needs in low-income communities, and the National Kidney Foundation is trying to work with the government and Medicare and Medicaid to find these issues and talk about them, and hopefully improve them for all kidney patients. So guys, all I can say is thank you for listening, and hopefully this situation will improve as time goes on for all of us in the kidney community. So guys, take care of yourselves, and I will see all of you on the next video.